Hello, my name is Claire Copley and I'm one of the professional nurse advocates for Cardio-Respiratory CSU, and we're going to talk about what the role of the professional nurse advocate is, how the role is beneficial to you, who are the P&As in the CSU, and how to contact us. The professional nurse advocate role is relatively new to the NHS and was first established in midwifery in around 2017, and then it was brought into nursing in 2021 during COVID. It is the first clinical model of restorative supervision for nurses in England that equips P&A trained staff to listen and understand the challenges fellow colleagues and teams are facing, and to provide and deliver quality improvement initiatives in response. P&As are trained in the AE-QUIP model to advocate for the patient, the nurse and healthcare staff, provide support and clinical supervision using a restorative approach, enable nurses to understand and undertake personal action for quality improvement, promote the education and development of nurses. P&As do this by creating a psychologically safe and confidential space for nurses to reflect on their experiences and process their emotions. They help nurses to make sense of their thoughts and feelings and develop action plans for improvement. They focus on well-being. They do not solve problems for nurses, but rather support them in finding their own solutions. But we will come on to the key responsibilities next. P&As aim to enhance nurses' professional resilience, improve patient care and reduce stress and burnout. The key responsibilities of a professional nurse advocate are to undertake restorative clinical supervision, which is where P&As facilitate individual or group sessions where nurses can reflect on their practice, explore their feelings and develop strategies to address challenges. They advocate for nurses, so P&As advocate for the well-being of nurses, providing support in situations such as stress, burnout, bullying, or they can provide career progression by offering scope for growth sessions. They provide quality improvement, so P&As can help nurses identify areas for quality improvement in their practice and support them in implementing changes to enhance patient care. P&As support revalidation. So P&As can help nurses prepare for and meet the requirements of professional revalidation. P&As promote a positive work environment. They do this by fostering open communication and a supportive culture. And P&As contribute to a more positive and productive work environment for nurses. They facilitate compassionate leadership. P&As help nurses develop compassionate leadership skills, which in turn improves team working and patient care. They support individual well-being. P&As address both the professional and personal well-being of nurses, promoting job satisfaction and reducing stress and burnout. Following a traumatic or stressful event, P&As can allow or create the opportunity for reflection to reduce stress and enable learning, limit compassion fatigue and improve confidence. There are lots of benefits from having a P&A session for the individual person and also for the organisation that we work in. The benefits for the individual are they feel supported, listened to and valued. They experience less stress, burnout and sickness absence. They have improved well-being, develop personally and professionally, improve job satisfaction, help to improve patient care, be less inclined to leave the profession, have increased confidence, feel less isolated, experience better team dynamics and develop clinical competence and knowledge. The benefits for the organisation is that they have a means of developing nursing practice to improve quality of patient care, improve communication between professional groups, particularly where clinical supervision groups are multi-professional. They have dissemination of good practice and shared learning, reduced turnover of staff sickness and absence. They have a tool for maintaining, monitoring and developing good practice, and innovation is encouraged. Staff are more motivated and have higher job satisfaction. So how does it work? Well, you can self-request for a P&A session or your manager can refer you. It can either be a one-to-one session or a group session, but if it is a group session, it may require more than one P&A to help facilitate this. Sessions usually last no longer than an hour, but you can have multiple sessions if needed. It is conducted in a confidential area, usually away from your working environment, to promote a psychologically safe space for discussion and reflection. Ground rules are established because they are confidential conversations that are happening, unless there are professional concerns which do require escalation, but that will be talked about at the time. The aim is not for the P&A to give advice, but to allow time to reflect and encourage self-problem solving. You can ask for a P&A that's also not in your area, if you prefer. We currently have 5 qualified PNAs in cardiorespiratory. So we do have Laura Mandel, although she's currently on maternity leave. We have Freya Palmer-Grayson. We've got Rebecca McCarthy, Sarah Mayman, and myself, Claire Copley. You can contact us by the CSU PNA email address on the slide, and we would be happy to arrange to see you, and there will be posters with this email going up in your areas as we speak. As we said before, if you didn't want to access a PNA from the CSU, we can also signpost you to other PNAs from other CSUs who would be happy to see you. There are also lots of other resources where you can access support for health and wellbeing, and your PNA can signpost you to these as well. As the PNA role is relatively new to our CSU, we need more staff to become PNAs so that we can really make a difference to our staff, teams and our patients. You will need to complete a university accredited course to become a qualified PNA, but it is a fantastic role with lots of great benefits. So if you're interested, please come and have a chat with us. Thank you very much.